Hey, hello, happy Wednesday. Today we are back in the Yo Arribas podcast, following this beautiful series dedicated to the mothers and all the moms and the families that want to get information about how to be a better mother, how to overcome any type of health issues, and how to be more in tune with our body. Being a mother, sometimes we forget about the importance of taking care of ourselves. We focus a lot in our babies. And in this series of podcasts that Dr. Nav Grewal is doing with me, we are talking about how we can educate and support the mothers out there. So thank you so much to be there listening to us. And I wanted to say hi to Nab. How are you today, Nab?
Hi, Joe. I'm doing great. Happy Hump Day. How are you doing?
Yes. I'm great. I went to Atlanta on the weekend, and actually I met my friends from Australia and some other friends in the world, and we met there, and it was nice because they all have little kids, so it's nice to see my friends becoming mothers, and it's actually not easy, and I'm very proud of them. They are becoming um, very mature and multitasking sometimes. They have to do so much, so I'm definitely loving to see my friends becoming mothers. So that's what I did on the weekend, sharing time with my friends and their little kids, and having always new topics to talk. As I see what the people are struggling with, it's good to always bring those topics that are actually real topics that are affecting us, and we can always show the way to cope with all this. And what about you? How was your weekend?
It was great. Thank you. Lots of yoga, lots of thinking about what I want to do in 2020, how to help my clients, my patients, the moms I work with, and big things are coming.
Beautiful. Yeah, 2020 is a great year, and I'm happy that we are connecting together in the community of Toronto, and we are creating a very nice platform with so many great professionals that we do have. And now we are not competitive. We just only one force, and one force that is helping and supporting each other. So I love this type of energy of abundance. And today we're going to talk about something that it could sound a little bit like a taboo for many people, but it is actually very important to know, and it's related to intercourse after our first baby or after a procedure. They could be related to a C-section, it could be a tear or episiotomy. So for any mother, this is for postpartum in this moment. We're just going to focus on intercourse after delivering babies. So I know people's like, do I really listen to this? Maybe yes, maybe.
You know what?
Yes.
But like, how was the baby created? It was through intercourse. So I think that's like a huge part. That's just like, oh, we can't, had a baby, we can't talk about, intercourse, but it's huge because a lot of mothers afterwards, especially when I think a lot of moms afterwards are comparing themselves to other people, and it's like, oh, this person, look how much the weight they lost, or like this person, they're doing this kind of activity, or they're already back at work, that kind of thing. And so there's a lot of pressure on moms, including returning back to intercourse, and they are thinking, oh, well, my partner waited this long, and I feel bad, and I want to do it, but they might be having, what we're going to talk about is pain with intercourse. And this is moms who have gone through C-sections. Yes, a lot of people think, you can't have pelvic issues if you've had a C-section, but we've talked about how part of the core includes the pelvic floor, and if the abdominal muscles are impacted, then what happens afterwards is the pelvic floor has to work harder, and that can create a lot of tension in the pelvic muscles. And then with natural or vaginal deliveries, if there's an episiotomy, for those who don't know what episiotomy is, it's if the baby is coming out and they think the muscles, the pelvic area is very tight, and it's going to lead to tearing, then they might make a small cut. Okay, so that's trauma. That can lead to scar tissue. Or naturally, if there's tearing, that can lead to trauma to the pelvic floor. And afterwards, that scar tissue, just like scar tissue anywhere else in the body, can lead to pain with intercourse, or tightness with intercourse, or sensitivity, irritability.
Yes. So this is a topic that it is hard to share unless you are very intimate with your close friends. But this is affecting everyone, and not only even related to just the moms, but also to other type of issues that it could happen, like after surgeries.
I've had women come in, like they've never had intercourse and they have these issues. The first time they go to try, they might have issues, and that can be related to emotional trauma or something they've been holding on to, or other trauma like in childhood, or naturally they might have tight muscles. And I think the more that we talk about it, the more, like other people can like be informed about it, and it kind of makes it as like a thing that, like something that isn't to be hidden.
Yes, very important to show our emotions in this way. We share, and we also, remind you that we're here to talk about sometimes topics that people don't want to bring up, but it's important to talk about this. So basically, today we want to be talking why this happened, and I was wondering. In my country, I'm from Venezuela, and we do something called cuarentena, which is like 40 days of no sex after delivering. It's just a 40 days of like relaxation where we're not putting any pressure over there. So is that still going on here, or what's your opinion?
Most of the moms who are coming to me wait for their 6-week visit, which is around 40 days, with their either midwife or OB, obstetrician, a physician, or they come and see me. To get cleared for intercourse, to make sure they are okay, to make sure they have healed adequately in the pelvic area before they participate in intercourse. And honestly, it's also just a way to like remind the woman, like the family, the partner, that we do need to heal before we try intercourse again. And so usually people are waiting, which is good, I think, to properly heal the area. I have had patients come in at 6 weeks and they've tried intercourse and it wasn't painful for them. So I'm like, okay, continue on. But most of the time people are waiting here. But they don't specifically give it that specific like name. It's more like, oh, the doctor has to clear me.
Okay. Yeah.
Versus something that's like, oh, I'm using this to heal myself. It's not like a societal thing. It's more like medically they're like, oh, I have to clear it by the doctor. So that's very interesting. Different cultural practices.
Yeah, the 40 days. Those guys are so desperate for the 40 days. I know. I heard that. So then how we know, like we have, because it could be just a little bit of tightness. What is the difference between being really in pain and being just tight? And if it's something that we could use to help this process, I'm sure you can talk about that. So
yes, so it's just like, I'm going to compare it to doing like, if you haven't done yoga in a while, or you haven't done stretching in a while, right? At first, like the first couple minutes, you're like, oh wow, that is stiff, that feels painful. But then it might go away, right? So same thing with intercourse. I've had clients come in and they're like, well, how will I know like when to stop and when not to stop? Because for a lot of them, they're like, maybe I should just continue on with this. Like with intercourse, even though it's painful, I don't know what the right thing to do is. Is this harming me or not? And so I always say for like the first couple minutes, it doesn't go away and it feels the same and it's not decreasing, stop. Do not progress any further. Stop. Or say they try it and it's painful, and the next time they try the same thing, they need to stop, or if the pain is increasing. If progressively the pain is decreasing, that's a great sign. If it's not, then there are other things we need to do, because if you do not stop, it will make that area very, very sensitive. And what happens is, it's just like rubbing an area and it's sensitive, and you keep rubbing it, it's going to become more sensitive, right? Or if you keep doing an exercise and you have pain, then you're going to have pain like with just like lifting your arm, even without weight, that kind of thing. And so what that does is, if that area becomes sensitive, then when someone goes to have intercourse, in anticipation of the pain, the muscles get very tight.
Okay.
Before anything happens, and then libido goes down. If it's not pleasurable, then no one's going to want to do it. So it's a vicious cycle.
Yeah, of course, especially after being pregnant, most of the women gain weight and they maybe not feeling as confident, as sexy as before.
Yeah.
So they already already trying to avoid that maybe. And emotionally, they may be thinking about so many things, and the last thing it could be sex, while the guys are completely all about sex. So
That's
yeah,
the
it could
number one
be
thing they're thinking.
for sure. So yeah, it could be a little bit of a challenge, but let's just make it easier for the girls. Why don't we just go for like a method of 1, 2, 3? So one, let's say, what about stimulation? Do we need lubricant?
Yes. So like using a lot of lubricant. So what happens is if someone is breastfeeding, prolactin is a hormone that is released, and that can lead to vaginal dryness. Okay, so if it leads to vaginal dryness, then again, sexual intercourse is not going to feel good, and so using lubricant is the first thing. Second thing is maybe before trying intercourse, even self-touch, touching yourself down there, because a lot of women after a delivery, they want to dissociate from that area because they're like, oh, a baby came out of that area. I don't want to really be thinking about that area or touching that area. And so using self-touch is a good way to self-pleasure is awesome. I highly recommend it, but also just preparing yourself for that. And then the third thing is, yes, a lot of people are quickly jumping to intercourse, but doing self-touch with the
foreplay
partner is important as well.
Okay.
So doing that, and if that is all good, then yes, try intercourse. So those are some steps to kind of follow progressively.
So what about internal and external, if we have to divide it that way? So internally?
Yes. So say someone tries those steps and they're like, wow, this is not going away. I still have pain with intercourse. I've tried all these steps. Then there are a couple of different things that we can do internally and externally. So let's start with external. So if someone shows up and they have, I would usually assess back mobility as well as hip mobility. So if someone comes in, we have these muscles attached into the pelvic muscle, so everything works together. And if their back isn't moving well, the hips aren't moving well, that can kind of contribute maybe to the pain that they're experiencing. So we would be doing a lot of stretches. Hip openers are great to do. And this is where yoga comes in. It's a lot of moms don't have time to go for an hour and a half class for yoga, but some things they can do at home are child's pose, happy baby, knee to chest stretch, anything that really brings the knee up towards the chest and opening up the legs and the hips. And then at the same time, doing belly breathing and actively thinking about relaxing the pelvic muscles is very, very important to do. So that's something that can be done externally. And then internally, massage, honestly, the spot, if I usually check when my patients come in for scar tissue, if it's an episiotomy, usually everyone has the episiotomy to the right because the physician is right-handed. Okay, so whenever I check for episiotomy, it's always on the patient's right side. And so when I find that scar tissue, we're doing massage. Using lubricant, using coconut oil. I teach my patients how to do the massage at home so that they can manage this at home. And once that area relaxes, then I tell them, okay, you are okay to try intercourse again. So using massage techniques internally. Similar to perineal massage that we talked about previously.
Correct. What about the dilatator? How you call it? Dilatator?
Dilators. Yeah,
dilator.
Yeah. So dilators are something that are used. This is probably going to look like sex, right? Some of them do come with vibration. So this is just in the packaging because they keep it in there to show my patients. But they come in different sizes. They can be made of plastic. This one is made of silicone, which is, no one wants to put plastic inside, right? So I usually recommend getting the silicone ones, and they're gentler, they're bendable versus plastic doesn't move. But if someone comes in and they're very, very tight and they can barely have one finger, which inside, which I've had a lot of patients like that postpartum, and a lot of women think, oh, I'm going to be loose down there. No, they actually might be very tight, okay? And so if they can't fit a finger, then we progressively use dilators of different sizes to help with stretching of the area. So this is inserted very, very slowly. It can be kept in for a few minutes, okay? And it can also be used for stretching, just going towards one side, holding, going down, going to the other side, because it's very hard to use your own finger internally for a long period of time. It's just going to hurt your wrist. Okay, so we use dilators, and they can be bought online, and they come in various sizes.
Okay, yeah, that all helps. Well, I never thought we could talk 15 minutes about the pain having intercourse. So yeah, it is a lot of information. I feel like now people, or like women that hear this podcast, can feel more familiar with the methods and with the solutions that we have. It is possible to reduce the pain. So once we start with this method, you think it will take maybe, it's an average, like maybe 4 weeks while the process reduces to no pain? Or
some patients, it's like 1 or 2 sessions, so it could be a couple weeks.
Yeah.
Because their scar tissue relaxes like that. Other patients, if they've pushed through a few times with intercourse and it's been painful, then their body gets very sensitive, and then for them to relax takes a little bit longer. Honestly, I've had some patients come in like they're like 2 years with pain with intercourse.
Oh.
They take a long, yeah. Like some women are just thinking it's okay to push through, and then they just get to a point where they're like, no, I need help. Or, this is going to sound really bad, they've been to other healthcare providers like gynecologists, obstetrician, physicians, and they've been told to just suck it up.
Oh.
Yeah, and then they don't know who to reach out to, and then when they finally come to me, it's been a long time. The longer the injury has been going on, sometimes it takes a longer time. So it can range from like 2 weeks, just doing 1 or 2 sessions, to a few months.
Okay, and the Kegels will be one of the exercises to start strengthening the muscles there, the Kegels, right?
Yes, but if someone comes in and they have very tight muscles, we do not start with Kegels.
Okay.
Because it's just going to make everything tighter. Okay. So a lot of women coming in postpartum, they're like, oh, teach me how to do Kegels. But then I say, okay, we need to make sure the muscles are actually relaxed before you do the Kegel.
Okay, yeah. That's a good thing to know. Right. Well, I think we have talked about many of the complications that happens after the deliveries. And I'm actually very interested about talking about the next topic next week.
Yeah, it's going to be a surprise.
It's going to be a surprise.
Surprise topic.
Well, there is so many topics. Actually, I meet my friends every week and I listen to what their challenges are. And I usually think about why I don't talk about this in the next podcast. So yeah, we are in this generation where the solutions are right there, and it's great to count with professionals like you. So you are a pelvic floor physiotherapist, and we can find you in Toronto. So why don't you just remember us where to find you?
Yes, so I'm at 5 different locations in Toronto. The best way to find the locations are to go to my website at pelvicare.ca. One of the places that I'm at is Toronto Yoga Mama, so that's primarily where we do prenatal postpartum care. You've been there. It's a beautiful space. Yeah. They hold a lot of different trainings there. They have prenatal postpartum yoga, and then all these other offerings, including pelvic floor physiotherapy, and it's a space where you can go and feel welcomed as a woman afterwards.
In Toronto, yeah. That's what I became a doula. So, yeah, great. We find you in Toronto, and I am here again in Toronto too. I'm a personal trainer, Pilates, and yoga teacher, and I'm here to, again, continue engaging myself with the community of Toronto and the world. So thank you so much, Nav, for being here, sharing your experience and your knowledge with us. And I can wait to talk next week about more topics related to motherhood. Thank you so much. Have a nice day. And remember, I always have to say this, together we are stronger.